This is Brent of the Brookbush Institute, and in this video we're going to do percussive or vibration release for the Erector Spinae. I'm going to have my friend Mike come out. He's going to help me demonstrate this technique. Now remember, we're not just doing this because Mike loves to have vibration release done to him. We're going to do this with the idea of getting some sort of outcome. So for example, maybe Mike has an anterior pelvic tilt. We know with an anterior pelvic tilt, the Erector Spinae are short and overactive. So we'll try release. Now, we're going to start on a slightly higher setting. As I've mentioned in other videos, it's a little counterintuitive. We start on higher settings more superficially with larger surface area pieces like this flat round piece I like, or the foam piece. Now, I'm going to go ahead and put this on setting 2. There is a setting 3, but probably not necessary to start with, especially with these thinner muscles up here in the Erector Spinae. Like, you're right over the ribs, so we don't need to pound Mike's ribs right into the table. That's not necessary. But I'm just going to go ahead and start just lateral to his spinous process. I'm going to use my thumb to kind of outline where his spinous process is, and I'm just going to kind of mow the lawn, is the analogy I give, noting any increase in like pushback, any increase in density, any place Mike lets me know that it's a little bit more tender there. I want to make note of that. But we're going to start off just going over all of the tissue, and you guys can see here I'm starting on the really thick lumbar erectors, just kind of mowing back and forth. And he definitely has some trigger points and some tissue density up here, because Mike recently had lumbar spine surgery. By recently, note, I mean, was it about a year ago? 6 months ago?
April 2nd, yeah, 6 months.
So 6 months ago, he's been cleared by his physician. Make sure if somebody has had surgery on their lumbar spine, you've been cleared by their physician before you start doing stuff like this. You want to make sure any modifications to the bone, any modifications to tissue have totally healed up. But other than that, we should be safe. So he does have some density here. Now you guys can see I'm working my way up the tissue here, nice and slow. Just trying to see if there's any other places of increased tissue density. I feel a little bit in here. You guys notice I'm not pushing the tool down into his back. I'm just using the weight of the tool. How's that feel, Mike?
I like it, it's good.
Any place that feels more tender?
There's been a couple of places in there where you can definitely feel it a little more pronounced.
Maybe in there a little bit. There. Alright, so he has a little bit in kind of his mid-thoracic spine, very common. Little bit of increased tissue density. This is thoracolumbar junction. Okay, so that's where your lumbar spine and thoracic spine meet. And then, like I said, around where he had that surgery, you know, that it kind of makes sense that those muscles would freak out just a little bit, maybe develop some trigger points in response to some of the trauma in that area. Have to remember, scalpel or a stab wound, body doesn't know the difference. So post-surgery, there's always going to be a little bit of stuff around the surgical area that has to be addressed. And then of course, as you get down here towards the bottom of the lumbar spine, guys, make sure you are keeping track of where the posterior iliac crest is, where those spinous process are, because if you catch the PSIS, the posterior superior iliac spine, it hurts. It definitely hurts. Now, once I've gone over all this tissue, and maybe I'd go over both sides, then I'm going to go ahead and I'm going to take off this piece. We're going to go smaller surface area. We're going to go lower setting so that the frequency doesn't pop me out and I can get a little deeper in those areas. So we'll start here. Once again, I'm going to use my thumb to border those spinous process. And then we know there's a little tenderness in there. How's that feel, Mike?
I like that, but it's definitely a little more tender.
Good deal. So it's the hurt so good sort of feeling, right? Like,
Definitely.
It hurts a little bit, it's a little tender in there, as release techniques are, but it feels like if I keep doing it, it's gonna get better. Now, if you have somebody who feels like it hurts and it's only gonna get worse, that would be a good sign to move on. And you'll notice here, I'm not really using that grazing, kind of mowing the lawn pattern. Now I'm really kind of very gently guiding the hypervolt here through the tissue in a very small area, trying to feel it release underneath the tool. All right, so that's his lumbar erectors there. And we might be catching some multifidi in there too, guys. I don't want you guys to think that somehow I'm differentiating between erector spinae and multifidi. It's his lumbar erectors I was after there. And then we had the thoracolumbar junction area, so right in here. Note, as I get close to the rib cage, I need to be careful how hard I press, because you'll get bounced right back from the ribs and it won't feel good to Mike. All right, so he has a little bit of tissue density here. Like I said, I'm just letting all the tissue release underneath the tool. I'm moving through nice and slow. And then of course last he had some in his mid-thoracic spine, which everybody knows this is one of those areas, especially for all of us who get stuck behind a desk. I can tell you I'm definitely feeling it more as the Brookbush Institute has grown and I spend more time behind a desk. Man, desk work definitely gives you some upper body postural stuff that you got to work through, and I would love to have somebody doing this to me on a daily basis, no doubt. Unfortunately, with the hypervolt, it is kind of hard to hypervolt your own thoracic spine. Just kind of slowly guide this through the tissue. All right, so just a quick recap. I was on a higher setting, level 2, right, with a larger surface area piece. And I kind of went through all of the erectors, right? And remember, your iliocostalis even kind of comes out a little bit, right? Really gets a bit lateral to that thoracic spine. Once I went all the way through that and I kept mental note of where my tissue density was, or an increase in tissue density was, I used the smaller bullet piece and I went back and just gently guided the tool through those tissues as they kind of released underneath the tool. And I think you guys will feel that. And then of course, if somebody's had surgery, make sure you're not doing this in the acute phase. I don't think surgeons are really gonna know much about this right off the bat. You know, this is a fairly new device, fairly new technology. You wanna probably err on the side of conservative. You know, like I said, Mike is 6 months. We can be fairly certain that anything the surgeon did has healed up pretty good at this point. His scar looks good. You know, he's been released for almost all physical activity at this point. Now we can use this to kind of clean up the tissues, you know, 6 months post. If you guys have any questions on this tool, please leave them in the comments box below. I hope you guys really enjoy this.